Hi, we're first year Master of Athletic Training students from the University of Montana, and with the help of our advisor, Val Moody, we did our study on assessing the effectiveness of using a moist heat pack prior to single leg vertical jump performance. My name is TediJo Todd.
My name is Sola Yeager.
My name is Katlyn Norton. Thermotherapy is a type of therapeutic modality. It is commonly used for subacute and chronic conditions. Thermotherapy increases circulation, it increases metabolism, and it decreases pain, muscle spasm, and tissue stiffness. Moist heat pack is a type of thermotherapy that was used in this study. A moist heat pack penetrates tissues that are 1 to 2 centimeters deep. They can cover a large amount of surface area, and their ideal treatment time for moist heat pack is 20 to 25 minutes for the best physiological effects.
Physiologically, moist heat packs increase intramuscular temperature through conduction. This also increases blood flow. Moist heat packs can increase extensibility of soft tissues, lengthening muscle fibers. Moist heat packs can also indirectly increase flexibility and range of motion when it is applied for 20 minutes. Previous research has shown that these factors may increase muscular power. Heating increased vertical jump values, as well as decreased time required to achieve peak muscle force. Previous studies have examined indirect correlations such as flexibility and range of motion on vertical jump performance.
The gap in the literature showed that there was limited research directly related to the effect of moist heat pack on vertical jump performance when applied to the hamstring. Much of the research is indirectly associated with flexibility and range of motion. Therefore, the purpose of our study was to explore and assess the effectiveness of a moist heat pack on single leg vertical jump performance when applied to the hamstrings. We hypothesized an increase in vertical jump performance would be observed after the application of the moist heat pack treatment to the hamstrings in comparison to jumping after the control treatment. For the methods of our study, for the design, we chose to do a repeated measures design. There was 2 days of data collection that were approximately 3 weeks apart. The participants randomly received one of the treatments on the first day and then received the opposite treatment on the second day of data collection. These two treatments were either control or moist heat pack. The participants were a convenient sample of members of our therapeutic modalities class. So there were 5 healthy first year University of Montana Master of Athletic Training students. They were not allowed to have any current lower extremity injury which could affect their jump performance, such as ankle sprains, muscle strains, or contusions, and they were instructed to abstain from exercise on both mornings of data collection. The instruments we used were the Just Jump, Just Run mat to collect vertical jump data, as well as the thermolator and moist heat pack. The procedures included starting with demographics of each participant. So we took their age, height, and weight. Then we instructed them on how to jump. The instructions were they were not allowed to have shoes. They had to jump on their dominant leg. They were allowed an arm swing and a slight bend, but they were not allowed to have maximal load. Therefore, they were only allowed to be in their athletic stance and could not dip. For the pre-treatment measurements, we took 3 jumps or measurements of 3 jumps. We eliminated the first and averaged the 2 best. And then after the data, we randomized them to either a control or a treatment group. So if they were randomized to the control group, they had to lie prone for 10 minutes on a treatment table. Then they repeated their 3 jumps again, and we also took the average once again. Then they received the moist heat pack treatment on the second day of data collection. On the first day of data collection, if they were randomized into the moist heat pack treatment group, they had to lie prone on the treatment table for 10 minutes with a moist heat pack on their dominant leg hamstring group. Then once again, we took their measurements of their 3 jumps and averaged the 2 best. And then they were in the control group the second day.
We set the alpha value for this study as 0.05. We ran a 2x2 repeated measures ANOVA, and we found that we had a p-value of 0.15, showing no significant statistical difference between pre and post vertical jump performance. We did observe a trend of improvement between pre and post treatments. However, this trend was very minute and was not significant.
In conclusion, the moist heat pack on hamstrings does not significantly improve vertical jump performance. Static superficial heat does not affect power production or performance. It engages in active warm-up or use of alternative heating modality, such as a sauna, to increase the intramuscular temperature of all lower body muscles to improve the vertical jump performance.